Yes, doctor, it's in slideshow.
Oh, good. So we can start. So we're going to look at cardiovascular imaging. This is the first part of the lecture. And so in the first part, we're going to look at mainly congenital cardiac lesions. We look at briefly at embryology and anatomy, and then the congenital cardiac lesions. And then in the second part, we'll be looking at mainly acquired heart disease. So as by way of outline, we'll be looking at, we'll have an introduction, we look at embryology, we look at the imaging modalities that are common for the imaging of the cardiovascular system. We'll be able to look at congenital heart diseases, and then a few specific conditions. So the fetal heart develops from a series of complex and rapid changes which occur between the second and the 8th week of intrauterine life. During the 3rd to 5th weeks, cardiac structures develop most actively and therefore are most susceptible to adverse external influence. For example, if you have infections like rubella virus, if you have drugs like thalidomide, or some of the cytotoxics, they may actually result in congenital heart disease. So the heart originates from the splanchnic mesoderm. The endocardial tube is the initial basic structure. Initially, it's a straight longitudinal midline tube, but then 5 dilatations occur along that tube. And these include the common truncus arteriosus, the bulbus cordis, the common primitive ventricle, the common primitive atrium, and the sinus venosus. So you have the truncus arteriosus, the bulbus, the primitive ventricle, the primitive, and so you're going to look at which structures then develop from the truncus arteriosus, which ones come from the bulbus cordis, and the other structures. Good. So from the truncus arteriosus, we get the adult aorta and the pulmonary trunk. From the bulbus cordis, we get the smooth part of the right ventricle arteriosus and the smooth part of the left ventricle, which is the aortic vestibule. From the primitive ventricle, we get the trabeculated part of the right and left ventricle. From the primitive atrium, we get the trabeculated part of the right and left atrium. From the sinus venosus, we get the smooth part of the right atrium, that is the sinus venarum, and then the coronary sinus and the oblique vein of the left atrium. So looking at the normal, we find that oxygenated blood comes from the umbilical vein through the ductus venosus, umbilical vein through the ductus venosus. The ductus venosus basically bypasses the IVC within the liver and goes into the right atrium. And that blood is directed through the right atrium, goes through the foramen ovale into the left atrium. Then from the left atrium, it goes into the left ventricle. From the left ventricle, it goes into the aorta, and therefore goes part of the body, gets that oxygenated blood. Then the remaining part now mixes that comes from the body to go into the